We have the return of vaccine preventable diseases. We've got political disruptions of the whole system that we deal with infectious disease. And we continue to have threats and emergence of pandemic scale threats. So the big story continues to be measles. The US has basically returned to endemicity from measles. It seems as if the South Carolina outbreak has ended, but Utah is a place where we're really looking at the number of cases going up and the difficulty in controlling an outbreak that's in the fundamentalist Latter-day Saints group. They're not just in places like Utah. Places like Oregon also have cases. And what's interesting about Oregon is that they've got cases that don't have a direct connection between them, which tells you there is undetected transmission. There are transmission belts that haven't surfaced yet. And they're also noticing wastewater detections of measles in Oregon where there are no clinical cases. So that's another state to watch. And I think it really speaks to the fact that measles is very, very difficult to control in the current era. Worldwide, countries like Bangladesh are having major outbreaks and launching major vaccination drives. There, the issue is opposite. They will probably uptake the vaccine very easily versus what's happening in the United States. Their outbreak is not necessarily due to choice, ours is. And I think what you see is that in the United States, measles is behaving less like, outbreak here, outbreak there, outbreak there. It's behaving like an endemic respiratory virus. And that's what we feared would happen when measles reestablish transmission. And likely we will lose elimination status later this year. And all of this is really just a really clear example of how lower vaccination rates lead to disruption. And people might say, oh, there's not that many deaths. There's 0 deaths recorded in the United States from measles. But that doesn't matter if children are getting hospitalized, children are getting immune amnesia. Why should they have to get that when their parents are choosing to not avail themselves of a safe and effective vaccine? So even if measles doesn't kill someone, it's still not something you'd want to have. It's not okay to expose yourself or get yourself exposed to something, even if it's sublethal. It makes no sense to me, but that's often the pushback I get on social media that, oh, how many deaths are there? And 0 deaths, oh, who cares? That's stupid. The other aspect of this is related, and that's the whole disruption politically of the way we think about infectious disease control, and that all stems from the head of the Hydra, that's RFK Jr., who is the Secretary of Health and Human Services. And he continues to exert influence, even if you're hearing that the politics are bad. It doesn't matter. Remember, he's ideologically driven. And I don't think that the politics matter so much to him. So you see him right now trying to reconstitute kind of the regulations around the Advisory Committee on Immunization Practices in order to make it easier for him to appoint people that are in line with his non-thinking, I would say, not thinking, but non-thinking. And that's what's happening. In all of this kind of, these court cases where they go against RFK Jr., that doesn't matter. RFK Jr. is still in power and he's still exerting influence. And the fact that he's trying to reshape ACIP just tells you he's ideologically driven. He's not sensitive to the politics because this is an ideological cause for him. And you have to understand that and not really think about it as a normal look at the polls. And that means RFK Jr. is falling out of favor. It's not going to change who he is. And you saw, for example, the acting CDC director stop the publication of a paper on vaccine efficacy of COVID vaccines. And this vaccine efficacy calculation is the same way we calculate influenza vaccine efficacy, but it was stopped by the acting director of CDC because it was going to say something, most likely because it was going to say something positive about the vaccine's impact. And this is why I keep telling people it's very difficult to trust the CDC right now. You've got really good scientists working there, but they're answering to a political class that's answering to RFK Jr. So you have to really look at everything that's coming out of CDC as suspect right now because it's all being done through a political lens. The CDC has always been somewhat political, but it's now hyper political and is now basically an organ of anti-vaccine propaganda run by RFK Jr. And I think that you're already seeing the effects of this, and we're going to see this policy lead to changes in behavior and then lead to disease outbreaks that are occurring. And it's not abstract what's going on here. This is actually really what's happening on the ground. These things happening in Washington and Atlanta are affecting what's going on everywhere. I wanted to also talk a little bit about avian influenza. As I've said from the beginning of me doing these videos, this is the biggest pandemic threat that humans face. And we continue to see avian influenza, telling us that it's aiming for a pandemic. It's not a question of if it will it will cause a pandemic, it's when. So we continue to see major bird die-offs. There was an article in the New York Times talking about bird die-offs in the Hamptons and Long Island, where people don't know what to do with the carcasses. No one wants to take responsibility for them. We're seeing major cases in poultry farms in places like Indiana. There have been backyard flocks, including in my home state of Pennsylvania, that have been impacted. And you worry about scavenging animals, mammals getting exposed, and allowing the virus more chance to adapt to mammals. There has been the first European case of bird flu, an H9N2, not related to the H5N1s that we're talking about in the United States, but an H9N2 in a traveler from Senegal to Italy. We don't know how he got infected. We know he had coexisting tuberculosis. We know he got hospitalized, but we don't understand where he got infected from. Those types of questions need to be run down if we're going to be taking this seriously, if we're going to be proactive and not reactive about avian flu issues. The thing is, no matter all the tools that humans can bring to bear, if we're not using the tools appropriately, it's not going to change the risk. But the fact is that early warning signals have been kind of flashing for some time. And while we don't know which strain of avian influenza is going to cause a pandemic, one of them will, just like it did in 1918. And we don't really have a proactive stance to it. Some other things I wanted to cover was just the power of vaccines. So this week there was new data on flu vaccine decreasing hospitalizations and cardiovascular events. So heart attacks. So influenza, when you get it, in the days afterwards, if you've got some substrate for cardiovascular disease, you have a high risk of heart attack. The flu vaccine blunts that response, therefore less heart attacks. So there's these cascading benefits from vaccines like the flu vaccine. But we often see them underutilized or not understood. Other vaccines that have been in the news this week, RSV, really underutilized in high-risk populations, especially the elderly, where RSV on a pound-for-pound basis is very similar to influenza, underutilized, even though there are 3 different RSV vaccines out there. HPV vaccine, which is basically the hero of the vaccines, one of the strongest vaccines in terms of efficacy against cervical cancer, continuing to show strong cancer protection, durable, strong cancer protection, changing the whole face of cervical cancer. The COVID vaccine safety data accrues. I kind of alluded to the fact that there's a beneficial study that's kind of pending at CDC. But when you look at, for example, myocarditis risks, those are something from the earlier part of the pandemic with a different version of the virus, a different version of the vaccine, when there wasn't immunity in the population. It's not really an issue now. But even when you look at things that are even more sensitive than myocarditis, like troponin, which is a cardiac protein, the number of individuals in that high risk group of adolescent to young adult males who get elevation of troponin, very, very, very small, telling you that that issue is not something that is really operating anymore, but it still operates in the minds of the anti-vaccine movement who continue to spread falsehoods about it. So what you see here with vaccines, the theme is really, really high protection, really great value. And I think that's something that's missed by a lot of people, that they don't understand how valuable of a technology vaccines are for living your life in a world in which there's lots of infectious disease threats. And that's something I think that needs to be thought through, that the way we frame vaccines doesn't look at them the way we look at a piece of technology like an iPhone. They're not looked that way. They're not looked at that way. And I think that people don't quite understand then why they should get the vaccine, because they don't see it as a technology benefiting them, but it clearly is. And there is data when you frame vaccine discussions relating to independence from disease or freedom from disease, people are more likely to take them. And I think that's something that people should learn to do. I've always talked about vaccines as a great piece of technology that allows you to navigate a world with infectious disease. But I don't know that I'm the only, that's a common way to frame it, but that's how I clearly see it. This week also, the past week also was the occasion of World Malaria Day. Remember, malaria is one of the scourges of humankind. It's said that over half of all people who have lived have died from malaria. We've got great technologies for malaria, insect-treated bed nets, anti-malarial drugs. We've got 2 vaccines that are with kind of middling efficacy, but important part of that layer approach. And then I think one of the most exciting things are genetically modified mosquitoes, which I think really could change the face of how we deal with malaria, because it really removes that risk by decreasing mosquito populations, and not all mosquito populations, just the ones that transmit malaria. And we've got, the two insecticides going on, so it's constantly a battle with this infection, and it still kills around 600,000 people a year. And countries like Nigeria are hard hit right now. Sub-Saharan Africa, very hard hit. Other technologies and things that I wanted to mention, we have really breakthroughs in HIV pre-exposure prophylaxis, lenacapavir, which I've talked about before, which is injections twice a year. Merck has a pill that's in clinical trials once a month, PrEP, to prevent HIV. So it's not an injection, so that might be advantageous as well. But we still have low PrEP uptake. So if you look at adolescents in the United States that have had a sexually transmitted infection or are engaging in high-risk behavior, not many of them get a PrEP prescription. So there's this tool sitting on the shelf, not in a resource-poor country, but in the United States. So I think if we want to cut down the tens of thousands of new HIV infections that occur every year in the United States, PrEP has to be part of that solution. Lastly, I wanted to mention the war in Iran. There's been a couple of issues related to infectious disease. Obviously, there's an uptick in diseases like chickenpox and influenza. Anytime there's war and disruption, you will see an increase in communicable diseases. They go together, war and disease. And obviously, I think that the blame for this is in my mind on the Iranians for being this belligerent dictatorship for so long, this theocratic dictatorship. And another story relating to Iran is their Institute Pasteur was bombed. A couple of things. This is something that some groups, including in Japan, have thought of as a biological weapons front. The US State Department kind of assesses the fact that Iran may have offensive biological weapons, and this might have been one of the places where that was going on. It was also a place where other researchers going on. So you worry about those pathogens leaking, and I also worry about the scientists leaking. Where are those scientists that might have been involved in offensive biological weapons work? Where are they going? So I think these are serious issues that aren't well covered by the press. The threat of biological weapons in general is underappreciated, and Iran is one of the countries where we think that those offensive biological weapons might be still, an operative part of their military strategy. So that's what I have for this week. And I think just to recap, measles, continue to watch measles. It's going to continue to spread in the United States and elsewhere. Avian flu, always keep your eye on stories about avian flu to see what's happening. That's where kind of the action is going to be with the next pandemic. And remember, right now, the biggest issue we face isn't these diseases, it's actually human made. It's the policy that's going on. So right now, we've got great tools and people knowing a lot of stuff about what's happening, but it's the inability to use those tools because of the policymakers we have. And I would say that infectious disease outcomes that we see now are not really about the biology anymore. They're really about the decision making going on in Washington and places like that. So that's what I have for the past week.